Newsmakers, here is Sam Shad.
And back on Nevada Newsmakers, we are very pleased to welcome to the program Dr. Jonathan Tay. He is with Radiation Oncology Associates and also works with St. Mary's Medical Center as the medical director for Reno CyberKnife. And I have to say that driving down the freeway, I'm not usually impressed by billboards, but you have a huge billboard on Highway 395, and it says cancer surgery without the surgery, Reno CyberKnife. What is CyberKnife?
Well, CyberKnife is a relatively new technology in the radiation oncology field, and it's a technology that was designed specifically to do a treatment called radiosurgery or stereotactic radiosurgery anywhere in the body. And
can I ask you, what does that mean?
Stereotactic radiosurgery is about getting a big, gigantic dose of radiation into a small, well-defined area somewhere in the body. And traditionally, that's been done in the head and neck area and for benign and malignant brain tumors with the gamma knife, but it has some limitations as the gamma knife can only be used to treat in the head. Other radiation oncology systems, traditional linear accelerators, have been modified or rigged to do radiosurgery elsewhere in the body, but because those technologies are modified from their purpose of doing something else to doing radiosurgery, inherently they're not as accurate as a CyberKnife, which was designed specifically for this task.
So the surgery word is actually kind of a misnomer, correct? Because you're not actually cutting anything.
We're not actually cutting anything. There are no knives, no needles, no blood loss with the process. But the surgery part of the definition comes from the response that we see in tumors. In certain tumors, they simply go away. And so some people equate the response that we see with this radiation technique closer to that of a surgical response rather than a radiation response.
If you're going to balance it out, what's comparable between regular radiation and CyberKnife radiation?
The difference is with regular radiation, the treatment fields that we use are much broader. Usually we have to treat with at least a normal tissue margin of several centimeters, compared to the CyberKnife, where we treat with normal tissue margins of 1 to 2 millimeters, or sometimes even 0 millimeters if we want to. And because of less normal tissue, we are able to get a much bigger dose of radiation in because there are no normal tissue constraints. And we get that big dose of radiation in just several treatments rather than a long, protracted course of radiation. The best example I would give is in prostate cancer treatment. With conventional modern radiation therapy techniques, a man would have to come in for 44 sessions, 5 days a week, over 9 weeks to complete prostate cancer therapy, whereas with the CyberKnife, we're able to do that in 5 treatments. For organ-confined disease, we can very much limit the amount of bladder and rectum that's in our field.
As far as cost goes, what is the comparison? Because obviously, I mean, that's a huge difference right there just in prostate cancer treatment.
I think it varies from region to region. In general, the cost is very much comparable to a longer course of radiation. The only one I've specifically looked at it for is prostate cancer. And for a course of what's called IMRT, or basically modern-day conventional radiation therapy techniques over 9 weeks in the outpatient setting, Medicare will pay somewhere in the range of $35,000 to $45,000 for prostate cancer, whereas for CyberKnife in a hospital setting, the cost is $22,500 is what we've seen our reimbursement as. So in some ways, even though it's more advanced technology and more sophisticated technology and higher upfront cost for acquiring the machine, the reimbursement is less.
Okay, what would be the cost of the machine?
Well, it depends if you're putting it in a center that's already existing or building something, from a piece of land. But in our situation, we were fortunate enough to have an extra radiation vault at the department in St. Mary's. And we had to relocate a little bit of equipment and redo some of the shielding in that vault. But the total project cost somewhere between $5.5 to $6 million.
Wow, so it's not a small investment.
It's not a small investment.
But over the long haul, it can save the patients a lot of money. Now, you have the only facility like this in the state of Nevada, because there's a lot of people watching and listening to this in Southern Nevada right now. What is their ability to be able to get treatment at St. Mary's? I mean, are you guys backed up, or is there availability?
No, we make an effort to keep patients flowing through the department as quickly as possible. And in fact, we've seen quite a number of patients from Northern California. We've seen patients who have family in the area come from Hawaii and Illinois to get their CyberKnife treatment. In a lot of situations, I do review the records ahead of time to make sure that they are CyberKnife candidates before they actually come to town for treatment. In a lot of situations, I try and send them to a CyberKnife center closer to them if there is one available before they come to Reno. But a lot of patients end up deciding to come to Reno anyway.
Okay, let's take a
whatever
break.
reason.
More on this fascinating topic with Dr. Jonathan